This is a video of a pretty hard cataract, almost grade 5 nucleus sclerosis. It almost looks black in color, as you can see from the video. So after fashioning my incisions and staining the capsule with trypan blue, put in some HPMC, and I am fashioning my capsulorhexis with the N26 gauge needle. I aim to get at least a 5.5 mm rhexis. Should not be smaller than that in such a hard cataract, but so far it seems to be going on very well. And that's it, the rhexis is almost done. That should be more than adequate. Having done the rhexis, I then proceed on to the next step, that is the hydrodissection. Obviously you cannot see the fluid wave. The only clue that you get is the forward movement of the nucleus after you have passed the wave posteriorly, and it looks like it's separated beautifully. However, I still put in some HPMC and take my dialer through the side port and rotate this nucleus both in the clockwise direction as well as in the anti-clockwise direction. This serves a couple of purposes. One, it breaks all the capsulocortical adhesions if there are any, and next it releases all the cortex, which makes cortical removal much easier during the subsequent procedure. So once I have aspirated all that superficial cortex, I take my the phaco tip is in my right hand, the sharp chopper is in the left, and I am planning to do the woodcutter's method of disassembly this nucleus. And as you can see, that's a pretty hard nucleus, and it's a pretty voluminous nucleus as well. And these sort of cataracts, you just have to be patient. You cannot hurry these cases. So I'm initiating my second chop, and the second chop is also good. I know there is a spine left. It doesn't matter. I'm not too worried about that. So in such hard cataract, it's always better to get at least 6 segments, if not more. And you can see, as I am laterally separating, I am going at different levels and trying to tear the posterior fibers apart. These leathery cataracts unfortunately don't crack too well because they have these fibers which stretch across the fragments, and they literally have to be torn away. So, and you can see how I am pushing the tip of my chopper into lower levels and trying to separate out that posterior plate as well. And please notice, as I am doing all this, the pupil is progressively shutting down on me. It looks like this is a mild floppy iris, although I'm not having too much of a problem, but you can see, watch the side port. Slowly the iris is tending to prolapse from there. Although I think I've already got 6 pieces, but I feel I should probably keep separating, and there I'm trying to take out this segment. Seems to be attached. I'm trying to take it out like a clover leaf. I've got it out partially, and now I decided I better come out. I put in some HPMC and substituted my sharp chopper for a dialer. Pupil is pretty small now. You have to be extremely careful because it's very easy to engage this pupil into your phaco probe. and this looks like a floppy iris. Once you do that, it will keep coming into your phaco, and now you can see this will come out very well. It just folds on itself till you get to that attachment in the center, after which everything will separate and it will all just neatly flow into your phaco tip. So you don't have to panic. Just stay in the center of that pupil. Don't go towards either of the pupil edge, proximal or distal, relative to my phaco tip, and keep flooring my pedal only when I have got part of that nucleus into my tip. And here also, look, watch how I am very carefully, I'm not engaging it now, no panic, move it to a more accessible area and then get it in. That's it. And that's easily done. Now there's a bit near the paracentesis as usual, just get it out with vacuum, bring it back to the center and zap it. There's hardly any cortex. Out of a few fibers I take out with my bimanual, then under HPMC I am injecting my single piece foldable IOL directly into the bag. It's a hydrophobic lens, and that's an extremely small pupil, and it has gone well. Thank you so much for watching.